Board members and the guests. I think you're good to go.
All right. It's 1 o'clock. I'll go ahead and call the meeting to order. Welcome, everybody. First things first, sorry, I'm still pulling up the agenda. Yep. Are we going to do a review of minutes from last meeting?
Review the agenda.
Does anybody have any changes to the agenda?
Mr. Chair, and members of the board, there's one minor change to the agenda. The communications update that was originally scheduled will be postponed due to staff illness. She wasn't able to be here today.
Anything else?
That's all. Thank you.
And sorry, I'm still pulling.
Sure.
I will next review the minutes from the June 26th meeting. Any additions or corrections to the minutes?
Mm-hmm.
Hearing none, the minutes are adopted. Next, we'll move on to introductions. We have 2 new board members, Mike McGuire and Dr. Nast. And I will is Dr. Nast on?
She is not.
On Zoom? Okay. Well, I'll go ahead and let Mike introduce himself.
Hi, my name is Mike McGuire. I work at Blue Cross Blue Shield, and I've had an interest in public health for quite some time, working in process improvement and watching how things went through the last pandemic and how we can learn from that. And I'm very happy to be here. So it's nice to meet everyone. Look forward to working with you.
Welcome.
Thank you. We also have new staff members. Drenta, would you like to introduce them?
Yes. We have one new staff member with us, and actually not entirely new, but we missed an opportunity at the last. We only do these quarterly. And so last time we were doing introductions, Steve was busy at the legislative session, or I'm not quite sure where, maybe on vacation. You were maybe hiking Utah or something. But
Might have been, yeah.
that might have been it.
Well.
Yeah, so I want to take a moment and introduce Steve Tennis to the Board of Health. He was hired as a sanitarian for our lead education and abatement program, which is connected directly to our East Helena Superfund site. And so Steve is here today. If you want to just say hi and give a little background and
Sure.
how much you love working for public health would be really great.
I actually do. That's easy. So my name's Steve Tennis. I'm a Helena kid. I'm a Helena adult. I've spent almost my entire life here. So this is a second stage career. I spent 35 years in public education, 32 at Helena High School, and the last 12 as the principal at Helena High School. And one of the things when I did retire, lobbying was not on my list, but we all have folks in our life that when they ask you to do something, they're not really asking, they're telling. And so I lobbied for public education funding in this last session. And one of the things that I was looking forward to when I retired is I got my degree in majored in biology and psychology, minored in chemistry. And that's originally what I did. Was I was a chemistry teacher at the high school. And if I could get back to my science roots, and this was a great match of the science piece as well as continuing to work with the public. I've worked with lots of former students already, which is it has been really really fun. So learning lots. I still have lots to learn, but I love that. And so yeah, this has been a great second act. So thank you.
Yeah, we feel very lucky to have Steve with us. So.
I would add on that one, he might be from Helena, but his wife's from East Helena. And we're glad to have him in East Helena.
I just moved to East Helena.
There you go.
My hometown.
Mr. Chair, do you want to circle back to Dr. Nash? She's joined us online.
Yeah, Dr. Nast. We just are introducing new board members and new staff. So Dr. Nast, if you'd like to introduce yourself to the other board members.
Okay, can you guys hear me okay?
Yes.
Okay, perfect. Apologies for hopping on late. My clinic morning went long. I'm Anna Nast. I'm a family doc at St. Pete's. Pretty new to the Helena area. We're coming up on a year. I got here last October. I do both outpatient family medicine and I do quite a bit of obstetrics and women's health. That's how I got interested in medicine in the first place. And then I'm working on my master's in public health. And obviously in the primary care setting and the women's health setting, there's just so many applications for public health. So really excited to get to see and get involved in the public health perspective as part of the board.
Thank you.
Welcome, Dr. Nast. And then I also like to take a second and introduce you to Fred Sargison. And you may have been here the last couple board meetings, but since we only do introductions of new staff every quarter, you had to wait your turn. So,
My name is Fred Sargison. I'm the operations manager here at Lucent Park Public Health. Also born and raised here in Helena. Was able to graduate from the University of Montana, which is a fine university over in Missoula. I left for about 15 years. Most of the last 25 years, I've run IT companies that service state, local, and federal government agencies, and had an opportunity to kind of shift my focus to public health and serving the public, and I'm thrilled with it. There's, as Steve mentioned, there's a steep learning curve, but the staff has been remarkably gracious in helping me come along, and feel kind of like I'm in the catbird seat to be able to find a new career, starting with so much to learn and hopefully to master over the next 25 or 30 years.
Well, welcome, Fred. Welcome, Steve, and welcome, Mike and Dr. Nast. And then, do we have employee of the quarter?
we do. I am thrilled to introduce Heather Palmer, who you all know as our wise and very highly experienced finance coordinator for the department. Heather is the one that helps us do some acrobats when it comes to getting a budget put together. And then the quarterly report that you all see and the year-end report, finance report that you all see is due to the magic that she and she goes through quite a process, because the finance system isn't an easy finance system to work with, which means that the reports that come out are not easy, which means that she does a lot of taking information out of one place and putting it in another so that you all can see the status of our finances. Not only does she do all of that, but she also works tremendously hard to track all of the different grants. About half of our budget is grant funding. And with that grant funding comes finance requirements to report back to the funders how we're spending that money. So the invoicing and the tracking and the documentation, it just goes on and on and on, the work that Heather does. When somebody comes in her office and needs information, she happily, with a smile, accommodates whatever comes through her door. She will stop what she's doing. And the only payment that she asks are coconut cookies from the diet. So she was nominated by Sandy. We have a peer nominated system here in the health department. Because I think it's really important that everyone has an opportunity to recognize the hard work that's happening. And so, Sandy, do you want to add anything from your perspective? You were roomies with Heather when you first started.
I was roommates with Heather. She was my suite mate, which absolute biggest blessing for me, because she has been here a minute and she has such diverse knowledge that trickles through every part of public health. So that was, a gold mine for me to pick at. But yeah, Heather is, she's a rock star. She is always willing to help, which is great. And you would never know. You might come in my office and I might look a little frazzled some days. You might pop by Fred's office and he might be scratching his head, but Heather is the same every day. She's not fazed by anything. You dump a mess on her and she's like, okay, let's get busy, which is great. She really is a a wonderful foundation for everyone to kind of, and everyone has to go see her about something. Everyone. It's great. In addition to, the only page with that cookies is, they will not want me to say it, but she will occasionally indulge in a Mountain Dew and extra sour, no, extreme sour Patch Kids, not just regular, but extreme. So
If she has a Mountain Dew and Sour Pouch on her desk, it must be a difficult
it's a
day.
difficult- that's the greatest sign of stress that you
Yeah.
might see is that. So yeah, no, she's definitely, she's wonderful, and she's meticulous at what she does, which is spot on what you want in her positions.
And not all numbers people and finance people are personable.
Yeah.
But Heather is incredible. She's so friendly and so helpful. So very deserving. And I think I've made her read enough. She's I've embarrassed her well.
Yes.
And that's what I have for introductions.
Thank you. And congratulations, Heather. Thank you so much.
Thank you.
Next, we have a couple of action items. We need to select a vice chair and a water quality protection district representative. Understanding that most of the board members are pulling double duty or have other things, I did reach out to Mike, our new board member, and given his background serving on other boards and working in that sort of relationship with other board members, I asked if he would be willing to be nominated as vice chair. I believe he's still interested in that. Yes. Okay. And then after the conversation we had at our last meeting, I confirmed with Sherry that she would be interested in being nominated to be the Water Quality Protection District representative. And is that still the case?
Yep.
Okay. So I guess starting with vice chair, do we have a nomination for vice chair?
So moved. I'll second it.
Second, thank you. Discussion on vice chair, or if you'd like to say anything, Mike?
I have nothing particular to say. Happy to help out.
Great,
Be the backup.
great. Any public comment?
And for the public that have joined us today, you can raise your hand and we will invite you in. Thanks, Marianne. Welcome.
Oh, hi, long time no see, Officer Neiman, Brenda Neiman. And congratulations to Heather too. My name is Marianne Dunwell. I'm a state senator. I represent, a lot of you know me, I represent the eastern part of Lewis and Clark County and Helena, and the two cities, Helena and the city of East Helena, in the state Senate. And I just put down on my notes that Heather, Mountain Dew for you, coconut cookies, and the sour candy things. Got it. So just congratulations, Heather. Thank you. Thank you all for the work you do, Heather, and all of you for the work you do. And good luck to the officers who are being nominated and chosen right now. That's all I have to say. And also the water protection person, because the health officer and I have had discussions about some of the water problems, like lack of water in two of the one city and one county mobile home park, and a couple of other water issues. So, and we know water's for fighting, so we've been fighting for it. So thank you for what you do. Bye-bye.
Thanks, Marianne.
Thank you. Any further public comment?
Mr. Chair, it looks like we are good to go.
All right. All in favor of the nomination of Mike McGuire as vice chair, yes, please say aye.
Aye.
Any opposed? Yeah. All right. Congratulations. Thank you. Moving on to Water Quality Protection District representative. Do we have a motion to nominate Sherry Osmosley?
So moved. I'll second it.
Thank you. Any discussion, or Sherry, if you'd like to say anything?
I do have a little experience with water quality. I worked in underground utility pipe work for many years. in the Bozeman area. My dad used to install septic tanks. So I get that whole thing. I've actually landscaped some very difficult spec homes for drainage, and have a commercial building in Helena that has been flooded 3 times, and it seems like water is a blessing and a curse in my life somewhat. So yeah, it's very interesting to me, and I'm really eating up everything so far that I've learned at the meetings. So I'm excited to do it. So thank you. Yeah.
Any further discussion? Any public comment?
No public comment.
All right.
Mr. Chair, if I could just interject just one thing. If we could advise Dr. Nast if she is going to vote, just to unmute. We've got her on screen, but just to unmute. We couldn't hear her.
Yeah, did you hear that, Dr. Nast?
Yes, I did. It sounded like there were plenty of ayes, but I'll add my eye in for that.
Thank you. All those in favor of the nomination of Sherry Osmosley as Water Quality Protection District Representative, please say aye.
Aye.
Any opposed? Congratulations.
Okay, thank you.
All right, moving on to the home visiting update.
So we have Mary Sparks with us today, and she will be delivering a nice update about the home visiting program. And she is relying on me to know what I'm doing over here to get her started. All right, there you go. All yours.
Can I scoot?
Oh, yeah, and if you want to sit here so that you
okay?
can navigate your
Yeah,
slides.
That would be great. Thank you. Mr. Chair, members of the board, I'm Mary Sparks. I am the Child and Family Health Supervisor at Lewis Park Public Health, which just means that I supervise all of the home visiting programs and our WIC program as well. So today I'm going to be talking a little bit about mainly our new program, what we call Grow Together, which is a universally offered home visiting program. Figure out what I'm doing here. Probably just the arrows, right? Okay. Yeah, there we go. First, I'll just let you know that we do have 4 total home visiting programs. We have Parents as Teachers, which works with families prenatally up to kindergarten. We have the Nurse Family Partnership, which is for pregnant women up to the child is 2. And those are typically women who are high risk and needing a nurse in their life. We also do the asthma home visiting program and help people with the triggers of asthma. So we're going to talk today about mostly about universals though. Okay, so just a little bit of background. The universally offered home visiting program came through the federal grant, which was the preschool development grant, if you've heard that federally. In Montana, we call it Bright Futures B5. And that program received a grant of $24 million over 3 years, 23 to 25. It had a lot of initiatives attached to it. One of them being universally offered home visiting, but you can see I listed a couple others in there. The Child Care Expansion Pilot, Child Care Worker Subsidy Program, Support Program, Employer Recruitment and Retention Strategies. So there's probably 4 others after that too. I didn't have room. So the first subgrant that they offered was the Universal Home Visiting Program, and we were one of 6 sites in Montana that received that grant. So if you're not familiar with home visiting, I'll just give you a little bit of background. Universal home visiting is a comprehensive approach to support all pregnant women and families with newborns. It's designed so that every family can take advantage of the support regardless of income or other risk factors, which is not true of our other programs. We have priority populations for those. We wrote this grant to really be in line with St. Peter's Health's catchment area, which includes Lewis and Clark, Jefferson, Broadwater, Marr, and Powell counties. So what we decided to do is that our home visitor would then have access to the Women and Children's Unit at St. Peter's, The grant does allow for you to visit with a mom, a woman prenatally, 6 weeks prenatally. But Florence Crittenton also got the grant in town, which was pretty unusual. And their focus was really that prenatal piece. So we focused on meeting with families at the hospital right after birth. So Haley, our home visitor, goes and she meets with families as often as she can get to the hospital. We're not there every day. But she meets with families and greets them and tells them about the program. We're allowed to have 4 total visits with a family over the course of the baby's first year. Sometimes those visits come all together based on the needs of the family, or they can come at different times during the year based on the needs of whatever they need. So she really focuses on breastfeeding support. She's also our peer breastfeeding counselor for WIC. So she started doing that, and then she saw that this job was open too. And so part of her job then became universal. She does car seat installations for families. She does several screenings. She will screen mom for postpartum depression. She can screen anybody in the family for substance use. And then she does the ages and stages developmental milestone questionnaire. And then the other big piece is that she connects people to other resources in their communities. Okay, so before I go on, I'm going to tell you a little bit about what has happened up front. When Haley started, she had her first day on the Women and Children's Unit, and I went with her, just kind of showing her what it would be like to talk to a family right after birth. And I want to let you know that that very first family that she walked into was a 16-year-old girl who had had emergency C-section. That girl, that woman, had her mother there. So she had some support, but Haley was able to connect with them right up front. Now, knowing she's 16 and having a newborn, we knew that that was going to be a family that would probably need to go on to further, to longer term support. So to the Parents as Teachers program. So Haley kind of helped with that transition, bringing baby home and breastfeeding. And then we connected her with our Parents as Teachers home visitor, Charity, and they did a joint visit together. When they did that joint visit, the mother was in extreme pain, and she had called her mom, and the grandma advised to take some more oxy. And the home visitors then said, I think we need to call your doctor. So they called the doctor and they advised to get into the emergency as quick as possible. She ended up having a blood transfusion. And when I speak about the program, that's the kind of impact we're making right now. We might not have known about that young lady ever if we hadn't been there at the hospital. So moving on, we were awarded this grant in July 1st of 24, but it was a very challenging start. So we didn't actually receive the contract until October. So I couldn't do anything in that first quarter. We hired our first home visitor in November, but she resigned in January. So Haley came along in February, and she's just been outstanding, getting going in a program that doesn't really have. It was brand new. We created it, so she's building the airplane as she's flying it. So as I mentioned, we had a priority of creating that lasting relationship with St. Peter's and having access to the Women and Children's Unit. So all of our home visitors now have badges as vendors on the Women and Children's Unit and can meet with families as needed. And as I said, Haley then goes on a regular basis to meet with families up front. So far, she has enrolled 15 families. And from those 15 families, she's made 17 referrals to other services in the community, including Parents as Teachers or Safe Care. That's 30% of her 15. It's not a lot of numbers, but it's a high percentage have moved on to longer term supports right up front, which is fantastic. She refers to WIC, SNAP, Helena Food Share. And then she had one family whose the father was deaf, and they were very concerned that he didn't he couldn't hear the babies crying. And so she connected them with Montech, which is an assistive technology program, and they can provide some support to the family. She's been able to be trained. She's working on her CLC, which is Certified Lactation Consultant. She is also working on becoming a postpartum doula. She's a birth doula right now. She's already taken the course in child passenger safety, so she's a car seat tech. And then she's going to be able to go through some courses on sleep consultant, which, you know, if you have babies, sleep is a big issue. Now, unfortunately, the grant ends. It was a pilot. We knew that. The contract did say that there was a possibility of a no-cost extension to June 30th of next year. Earlier this summer, they let us know that that would not be allowed. So we are done with that grant at the end of December, which leaves us, since we had kind of a rough start, leaves us with some money that we need to spend down before the end of December. And then we also are working on trying to figure out future funding. So it's a weird quandary to be in. So our spend down, we decided that we're going to create a community baby shower. I don't know if you all saw our sign outside, but what we found over the years is that a lot of families don't ever get a baby shower. And you all know how expensive babies are. But not only that, we want to have an opportunity to honor women who are having a baby and may not have had that chance to get that feeling of a baby shower. So we are going to have a baby shower, a community baby shower, on November 2nd at the Delta Hotel, and you're all invited if you want to come. We are asking for donations, and you're probably asking, why are you asking for donations if you got all this money to spend down? Well, my hope is that this becomes an annual event for the community. So we decided to put it out there to the Chamber of Commerce and see who would like to be a donation site. And these are so far who our donation pack and plays will be at. So each site will get a pack and play. That's where people can donate diapers, wipes, whatever they want to donate. The difficult part is now looking for future funding for the program. But Brenda and Fred and Sarah Sandow and I have all been putting our heads together, trying to figure out different ways to keep the program going. If there's no federal grants coming, then we have to look in every other corner. We're looking at local funding and partnerships. There's smaller grants around, like St. Peter's has a sponsorship. These are going to be smaller amounts that we may be able to put together. There are larger foundational grants, but there's a lot of people going for the same money right now. And so we had a conversation with Healthy Mothers, Healthy Babies, which is a state organization. And we asked them if they would be interested in trying to apply for a larger foundational grant that would then fund the 6 sites in Montana. A lot of these big organizations want to make a big impact, and funding a program across the entire state of Montana would be a big impact. So they're working with us and we're working with them. We didn't tell them, go write a grant for us. We're going to help them write grants and see if we can help keep it going around the state. And then we're talking about ways that we can bill insurance. It's a lot of things to think about. Because we don't bill insurance for this type of work right now, but there's some possibilities out there. And so at this time, I'm just putting it out to you guys to think about what other funding opportunities there might be. We're hoping that this program continues because we really have seen that impact. And personally speaking, I was a mom that probably didn't look like I needed some support when I had my son 100 years ago. But he was born with a blood infection and a heart condition and was in the NICU. I was married at the time. I had lots of family around. I have a master's degree in special education, and I was terrified to bring my son home. And this kind of support would have been exactly what I needed. I mean, obviously I made it through, but it was a rough time. So and the fact that we're trying to serve people in those rural counties is huge, because up until this year, our other home visiting programs didn't allow us to go to like Broadwater or Marr counties. And just to speak a little bit more on that, with Powell County, we did write it for Powell County, but Butte 4Cs also got the grant, and they tend to go to Powell County easily. And so we partner with them to take families that have given birth here, and then they get services in their home. Well, that was kind of quick, but if you have any questions, I'd be happy to answer any questions I can.
I do. Is there any liaison between Options Clinic or Florence Crittenden Home?
Florence Crinton, we work very, very closely with.
Okay,
In
good.
fact, they provide some of the same home. They provide a universal, and they also provide parents as teachers. So we actually work in a partnership, and like when we get referrals in, Jen Burkhardt over there and I take a look at those referrals together and figure out which home visitor is the best person. So it's not a competition at all with us. And Options Clinic is actually on our home visiting task force and our advisory council for Universal. And so we're in close contact with them. In fact, we're also having conversations with, there's a fella at the state that is a liaison between faith-based organizations and community-based organizations. So we have a meeting actually tomorrow morning to talk with him about that type of partnering, since I think we probably have the same mission as a lot of churches in town. So I'm trying to think of every potential.
The other thing is putting a pack and play in churches.
Yes. We haven't done that yet, but that would be, next on the line.
I think that people would be, I know my church would be very willing to.
What church are you
Life Covenant.
Okay.
Yeah, they're really supportive of things like that, especially the babies and families.
Great.
So
we can reach out for sure.
Okay.
Yeah, thank you.
What's your budget need? What dollar wise, what are you looking for?
Dollar wise for next year, oh my gosh, where's Brenda? Probably at least 100,000.
100,000 would support a staff person, salary, benefits, and then other expenses associated with having a staff person here. So supervision, technology, rent, supplies. 100,000 is a good guesstimate of what supports a position like this in the department.
Dr. Nasta, I'm sorry, did you have a question?
Yeah, well, and the comment too, I just wanted to say this is really truly such valuable work. I've worked in a couple of different states and hospital systems at this point, and I think we have the best home visiting options of any place I've worked. And it's been, as a provider, there's people I've discharged from the hospital, a day earlier than I would have felt comfortable knowing that they could have such good follow-up. And it really truly is for all parts of the community and healthcare system such valuable work. Have we looked into calling it a postpartum doula service at all with Medicaid coverage now?
That is, yes, that is something we're looking at when we think about billing insurances. Yes.
Okay.
And Haley is working on that certification for postpartum doula.
Okay. And then obviously if there's any input for any of these parts from a provider's perspective, advocacy, any of that, please let me know. This is about a third of what I do in my clinic, and it is so truly valuable, what you guys are doing.
Well, thank you. I appreciate that. Your questions? If I have a minute or 2 minutes, can I play this?
Yes.
I'm not sure how to plug it in. Over here.
Yep.
So I'm gonna play for you a video.
Well, and then you can close that. Okay. Now that you're done with your stuff.
Take Dr. Nast out.
You might want to move her down. There you go. Because I'm not sure you.
Okay. And then I
can find the
get
file.
file.
I should have closed out all of the excess stuff on my computer before the meeting today.
So we worked on a little video. A lot of places where we go do outreach don't really understand what you're talking about when you're talking about home visiting. A lot of people think home health or they think of maybe CPS. That is, we work closely with CPS, but we're not CPS related. So we created a little video. It is a bit of a work in progress. Katie Maslowski is one of our home visitors, and she's a really talented photographer. And she realized she's not a videographer. So get this going.
And then pause it. What? And come back up here and expand her back out again.
Okay.
Perfect. And then we're gonna share. And then share sound. Yeah.
You're so good at this.
And then the video.
Now share and share.
If you click on that, you can probably expand. And then you can hit play and she should be
Okay.
able to hear it.
Home visiting programs are so special. They connect you with a trained professional who provides personal support, education, and resources in the comfort of your home. These services are available free of charge to pregnant women and families with children under the age of 5. We can offer a wealth of benefits, including better birth outcomes, enhanced child development, and increased parental confidence. Becoming a parent can be overwhelming. The questions and worries can seem endless. But when you have someone there to provide support and cheer you on, it can make all the difference.
Calming those worries and just kind of being somebody who was like able to reassure me that, hey, I'm doing stuff right and I'm doing good. It's really nice to hear that, and just that she's healthy, she's thriving, she's good.
That's it. Okay, screen sharing and stuff. Okay. Any other questions? All right.
Thank you so much.
Thank you.
Yeah, thank you. Good job.
I remember when Haley started,
Yeah.
like, everybody was very excited, and it's good to see that the excitement has continued, and that everybody's sort of expectations for the program have been realized.
Yeah.
Awesome.
I would say expectations met and exceeded. When you hire the right person into a position, especially as special as this one, that's when we start to see the outcomes. So it's the combination of a really amazing staff person and an opportunity to provide a really special program.
Yeah.
So just really proud of what we've been able to accomplish, and we'll continue to. We'll figure out a way.
All right. Next, item 6, fiscal year 25 year-end financial report.
Right. Dr. Nast, if you ever have issues seeing what I'm sharing, it's because I've erred on my end. Will you just speak up and let me know so I can make that correction for you?
Absolutely, will do.
All right. Sorry. All right, here we go. So our year-end financial report, and I do have Heather here as my backup. She'll have all of the details that you need if you have questions about the items that we're going over. Does anybody know how to get that? Oh, okay. Magically moves out of my way. So fiscal year 25, began July of 2024 and ran through June 30th of 2025. And on page 10 of your packet is a summary of the overall revenue, which is at the top of the spreadsheet. We have a variety of revenue that comes into the health department. What we budgeted as far as a revenue guesstimate is going to be located in that left-hand column. And then what we brought in is in the total received year-to-date column. So $2.6 million was brought in revenue, which was just short of our projected overall revenue. We brought in 88 or 88.65% of what we thought we would. If you come down to the next box down, this summarizes our personnel expense for the fiscal year 25. So we had projected spending over $1.2 million in personnel for the department. And then if you move over to the total year-to-date spent column, you can see that we spent just over $1 million. So short of what we projected in the budget, and we only spent about 84% of the budget on personnel. Before I move to the next page, any questions on revenue or personnel for fiscal year 20? The next page, which is kind of hard to see because there's an awful lot going on that page. This represents a summary of all of the operational expenses for fiscal year 25. And so it breaks down all of those operational expenses into a variety of categories, and you can see those in the far left column. The next column over is going to it'll show you what we budgeted for fiscal year 25, which equaled $1.3 million in operational expenses. And then if you move over to the column that says total year to date spent, we spent $1.4 million. So we were at 110% of our budget for operations expenses. And I'll pause there before I give you a couple more highlights, which are located at the bottom of that spreadsheet. My glasses are not working for me. All right, so at the bottom left-hand corner, what we see there is cash flow. And so you have the just kind of a summary of how we started the fiscal year. So beginning cash balance was 1.1 million. We had revenues of 2.9 million that came in over the course of the fiscal year, 2.7 million in overall expenses, with an ending cash of the is it the 1.3 or the 244,000?
The one.
This
is our ending cash rate.
Oh, so I was giving you the wrong information. Sorry. If you move over to the box in the middle of the bottom of the spreadsheet, for those of you that are looking up on the screen, it's this ending cash balance of $1,085,830 is our ending cash balance at the end of fiscal year 25. And so what that equates to is a 145-day reserve of cash balance moving into the new fiscal year of fiscal year 26, which is over what we aim for. So we're in good financial standing as far as having funds sitting there. We are looking for a 90-day reserve, which is actually 673,000. If that's our goal, is a cash reserve of 90 days. That 145 days, though, will help us in this year and into the next year when we have significant issues that we're going to encounter with federal funding. And so we talked about that a little bit when we did fiscal year 26 budget, that we have planned for the loss of federal funding in this year, and then we are anticipating federal funding loss for fiscal year 27 as well. So this cash balance will help us hopefully weather some of that loss. It won't, depending on what happens, which is unknown at this point. It's not going to help us save all the programs that are currently funded through federal funding. About just short of half of our budget is grant funding, and a good chunk of that, if most of it, is federal funding. Our federal funding is right now supporting suicide prevention and substance misuse prevention. The work around the mobile crisis response team in the community, chronic disease prevention, cancer control, tobacco prevention. Those are the types of programs that we have in the department that are federally funded. And so depending on what happens with the federal budget and how they choose to put money out to the local, state and local health departments, we'll have to make some pretty hard decisions moving forward about what we can keep and what we can fund and what we can't. So, but that cash balance, that really healthy cash balance that we have now, will help weather some of that. So, depending on how bad it gets, and I'm gonna hope for the best, but we need to plan for the worst. The Board of Health will need to help us make some of those decisions, help us prioritize based on the strategic plan, help us prioritize. Of course, state law already prioritizes for us some things that we do. We have to do them. So those things will of course continue. Most of what we have to do gets funded by our health mill property tax revenue anyway. But if we have to get to the point where we're making some tough decisions about what programs we're keeping and what programs we're not, the Board of Health will need to help us through that. So just anticipate that into this next budget year, which is coming quicker than we realize. We're already in August of fiscal year 26. So we'll, starting January, be looking at building fiscal year 27. And hopefully by then we'll know a little bit more about what's coming from as far as federal funding is concerned. Questions on our year-end report?
It seems like a lot of the stuff that has come through, it takes a while to find out where we're at, because I know a lot of times we're approving budget or grant applications halfway through the year.
Yeah.
And are there any, what things have you definitely been told won't go right now or?
So right now, what we've been told is a significant reduction in our cancer control program. And so the staff person that does that work within the health department is down to a half-time position. She's been with us for 15 years doing this work as a full-time position. So that program is been reduced down to the point where we've had to cut her FTE. All of the other federal funding was connected to last year's federal budget. And so all of that is still stable. There were no big changes to it because the courts essentially ruled that those funds needed to be distributed out as planned. And so it's really the funds that will come out of this year's federal fiscal budget that's being developed right now. The budget's been developed, but the federal allocation that's done by Congress is in the works. And so until we know what Congress is choosing to fund out of the budget that's been developed, they're not going to put out new grant opportunities for us to apply for at the local level. So that's all. I anticipate all of that kind of concluding by the end of the year. The federal fiscal year starts October 1, but it would be pretty surprising to me if they actually have allocations ready to, appropriations ready to go by October 1. So a continuing resolution is anticipated, which means we probably won't see grant funding posted to apply until after the first of the year.
I have a question.
Yes, ma'am.
What is the cancer control? What do they do?
So our cancer control program helps individuals who are uninsured and underinsured get connected to screening services. So mostly breast and cervical. We had a colorectal program, but that's one that got cut. So it's primarily focused on getting women connected to primary care and get their screenings done. We know that if women do their screenings on a schedule that is recommended, that we can catch cancer sooner, and then the treatment is less expensive and the morbidity and mortality rates are not as significant. And so the goal of that program is to find the women in the community that are not getting screened as recommended, and make sure that they get connected, and then we have ability to pay if they don't.
And that's one staff.
It's a half staff.
It's now half staff. It went from
half-time
one
staff
to
person.
half.
Mhm.
Where are
Yeah,
those
and-
screenings? Oh, sorry, real quick. Where are those screenings actually happening? Out of curiosity.
The screenings are happening in the community where they typically, so it's up to the patient where they want to be screened. So the diagnostic and imaging at St. Peter's, for example, is one of our main screening locations in our community, but I think there's a couple of others. So it's up to the patient where they get screened, and then we pay. So we help them navigate to care, and then we pay for the bill. What concerns me about the reduction in that staff person is that we're also anticipating some Medicaid, Medicare impacts to decisions that are being made, Medicaid in particular. I'm hoping Medicare won't change, but again, a lot of unknowns. But Medicaid, if there are cuts to Medicaid, then this program then becomes even more important. And we won't have the capacity to serve. We won't have the staff to help the women who are now with Medicaid cuts would then be eligible because they're uninsured, underinsured, and would qualify. Right now, a lot of women are covered by Medicaid. And so they have the ability to, they have insurance coverage and can get the care they need. So with those cuts, the number of women who need the program will go up, and we won't have staff capacity to handle that influx. So that's my concern about what's happening right now.
Thank you.
Yeah. I feel like it's a big puzzle and every piece matters. And so trying to figure out where to put the pieces to maintain the services that we have and the impact that we can have in our community. So.
How many individuals did the program serve?
That's a really good question. I may have to get back to you on that. Melissa was just here at the Board of Health a couple months ago responding. Well. And I don't know that I remember off the top of my head what her numbers are.
Okay, that's all right.
But why don't I follow up?
It would also be interesting to know, as part of that, do we have projected increases in uninsured and underinsured rates? I know that's unpredictable,
Yeah.
but
It is, yeah, and that we'll know that when we actually see what happens with Medicaid at the federal level, and then also what happens with Medicaid at the state level, because it's both and. The federal government contributes, and then the state contributes, and so if the feds cut Medicaid, the state has the option to maintain or increase funding to help balance that. I don't anticipate that in the state of Montana. My guess is that it will be cut at the federal level and then subsequently cut at the state, but I'm also just speculating. So, but we have to watch kind of both of those things happen and then make an adjustment at our level on what we're able to do, who we're able to serve.
Although, I think there is some hope on that level. I mean, it looks like the Hospital Association had some pretty good clout at the legislature, and that might bode better than it could be too.
Yeah, well, and the legislature supported the Medicaid expansion.
Yeah.
So that is that's a hopeful that was a hopeful vote. That our state did support the reauthorization of Medicaid expansion. And it is Medicaid expansion, most likely that population that's going to end up getting cut at the federal level. So we'll see. We'll just have to see what happens. But you're right. The hope is we got to hold on to some of that hope and continue to advocate. We have the Hospital Association, the Primary Care Association, the Medical Association, Public Health Association. They're all working really hard at advocating at the state level. So. Anything more on the finance report? All right. Heather snuck away because you didn't have any questions. She said, I will stick around in case you get hard questions.
All right, well, number 7, communications update was postponed. Number 8, Region 5 Public Health Training Center determinant of health. Brenda, is that you?
Yeah, and actually it's some online training that we'll do as a board today. Sometimes I'm not a big fan of online trainings, but this one in particular I thought was very well done. And in your packet is a handout that goes along with the online training. So we'll go through the modules, and I think the whole thing took 30 minutes, but I'm going to skip a couple of the modules that will hopefully keep that a little shorter. But I really feel like learning about the determinants of health is important. Within our strategic plan, our initiative number 1 is all about health equity and social determinants of health. And one of the strategies is to ensure that the public health staff are well trained, and that we are thinking about determinants of health in the work that we do. And so I thought it would be really important also for the board to have the language and an understanding of what this is, so that you can have an understanding of the work that's happening that we do that may seem and look a little different than what public health historically or traditionally has done. Public health has its real strong foothold in communicable disease. We inspect licensed establishments like restaurants to make sure disease doesn't spread. We provide vaccine clinics to offer like flu and RSV vaccines during respiratory illness season. That's just normal, typical, everyday public health work. The work around determinants of health looks very different. It's really work around making sure that residents in our county have access to high quality education. So what's going on with the school bond right now is an example of a determinant of health, because we know that if students have access to high quality education, their overall health is better. If they have access to resources, financial resources, so good jobs and health care, that also contributes to overall health. Walkable neighborhoods is something that contributes to overall good health. And so that's what you're going to hear discussed. The Region 5 Public Health Training Center they do a really excellent job of putting out professional development opportunities for public health staff. And this one was made specifically for boards of health. So with that, I'll stop talking and let them take over. And again, Dr. Nast, if this starts and the volume is not heard on your part, please let me know.
Welcome to Determinants of Health. The concept of health is often framed around the individual, but what we do collectively as a society can have a much larger impact on health. With evidence-based approaches and population health frameworks, we can understand the many factors that impact the health of individuals and their communities. The many factors that influence health are demonstrated by this commonly referenced model created by Dahlgren and Whitehead in 1991. The individual, at the core of this model, has genetic and biologic factors that cannot be changed. Surrounding the individual are factors that are modifiable, and depending on the modification, may help or hinder a person's health. Immediate to the person are behavioral and lifestyle factors that are under the individual's control. But these factors are influenced by the surrounding social and community networks, which are in turn influenced by larger structural issues such as housing, working conditions, and access to essential services. The range of personal, social, economic, and environmental factors that influence health are referred to as the determinants of health. And while there are complex interactions with each category, making it difficult to accurately measure how much each contributes to health, social and economic factors have the biggest impact, much more than our genes and biology or the medical care that we receive. The health impact pyramid, described by Dr. Frieden in 2010, shows that interventions targeting social and economic factors will have the greatest impact on the health of a population because they reach more people and require less individual effort. However, there is a mismatch in how the United States spends its money on health. The majority of the national health expenditures are spent on medical services, while very little funding is directed to the larger contributors of health, the social and economic factors. Though clinical care is a smaller contributor to the health of a population, it is still an important determinant of health. Reliable access to good quality, comprehensive health care is important for promoting health, preventing disease, and managing problems before they get too severe. Without access to care, due to reasons such as transportation or lack of insurance, people have worse health outcomes. Medical costs can deter people from seeking medical care, resulting in hospital visits and poor health outcomes that could have been prevented. People in worse health tend to be more likely to delay or go without medical care due to concerns about cost. In addition to the medical care we receive, our genes and biology contribute to our overall health. Genes determine our physical characteristics and how our bodies function. The Human Genome Project was an international 13-year effort from 1990 to 2003 that identified the DNA sequence of all 3.2 billion base pairs in the human genome. This project made it possible to study the genetic basis for health. In some cases, a disease occurs due to an alteration in a single gene or chromosome. An example of this is cystic fibrosis, in which a mutation in a gene results in the production of mucus that is too thick and sticky and that can cause organ dysfunction, especially in the lungs, pancreas, and other organs. Some genes can increase the likelihood that a disease will develop. For example, inherited mutations in the BRCA1 and BRCA2 genes can result in tumor suppressor proteins that are not able to properly repair damaged DNA, and as a result, cells are more likely to accumulate genetic mutations that lead to cancer. Other diseases do not have a single genetic cause, such as heart disease, but are likely associated with the effects of many genes in combination with lifestyle and environmental factors. But genetics, which is the study of individual genes, and genomics, which is the study of the complete genetic makeup of an individual, are important to public health. In fact, genomic activities can support each of the 10 essential public health services.
We're going to click through those, but I'll pause there so you can be reminded of what those 10 essential services are. Everything from monitoring health to developing policies and evaluating our work. Genetic factors are closely related to biological determinants of health, as genes have a part in determining the structure and function of our bodies. Biological determinants include factors such as age, sex, weight, immune status, and nutrition status. In addition to genetic and biological factors, the physical environment is a determinant of health and includes elements of the natural and built environment, such as green spaces, air and water quality, transportation, housing, and accessibility. The places that people live, work, and play have an impact on the health of individuals and their communities. When it comes to improving health and preventing disease, a great deal of effort is focused on an individual's behaviors. Studies have shown that the leading causes of death in the U.S. can be attributed to preventable behaviors and exposures, such as tobacco use, poor diet, physical inactivity, and alcohol consumption. Health behaviors are a significant determinant of health, but changing behavior can be difficult. Healthcare providers can use strategies like
setting SMART goals that are specific, measurable, attainable, relevant, and timely, problem-solving barriers that may prevent a person from making a behavior change, and encouraging self-monitoring of a specific behavior. Programs that are designed to improve health behaviors are more likely to succeed if the strategies used are based on a clear understanding of the targeted health behaviors and the context in which they occur. Health behavior theory as a foundation for program planning is consistent with an evidence-based approach to public health. The health belief model suggests that behavior change is more likely to occur if interventions target an individual's perceptions of benefits, barriers, and threats, and an individual's self-efficacy. The stages of change model, also known as the trans-theoretical model, describes an individual's motivation and readiness to change behavior. It states that behavior change is a process and people at different points in the continuum benefit from different interventions designed for their stage. The theory of planned behavior assumes behavioral intention is the most important determinant of behavior, and that intention is influenced by a person's attitude, perception of their peers' approval, and perception of having control over the behavior. The social cognitive theory describes the influence of individual experiences, actions of others, and environmental factors on individual behaviors. Beyond healthy behaviors, the concept of behavioral health, which refers to people living with mental and/or substance use disorders, is an important and sometimes overlooked aspect of public health. Suicide is the 10th leading cause of death overall in the United States and is the second leading cause of death among individuals between the ages of 10 and 34. Persons with serious mental illnesses have healthcare costs that are 2 to 3 times higher than the general public. A public health approach to behavioral health includes strategies such as strong community partnerships, integration of primary care and behavioral health services, trauma-informed services, and integration of behavioral health programs into schools. While much of the national healthcare expenditure goes to clinical care and much of health promotion programming is directed at individual behaviors, it is the social, political, and economic factors that influence access to clinical care and individual behaviors and are significant determinants of health. Improving these upstream factors has a greater impact on population health and can decrease the effort required by an individual to achieve good health. These factors are often referred to as the social determinants of health. The social determinants of health are the conditions in places where people live, learn, work, and play. They include economic stability, neighborhood conditions, education, food access, community context, and access to quality health care. These conditions have an effect on a wide range of health outcomes, including health status, life expectancy, morbidity, and mortality. Healthy People is a nationwide program of health promotion and disease prevention goals set by the United States Department of Health and Human Services. The 2020 edition of Healthy People was the first time the social determinants were specifically recognized. They were organized around 5 key areas: neighborhood and the built environment, health and healthcare, social and community context, education, and economic stability. Planning for Healthy People 2030 is currently underway. In this next version, we can expect the social determinants of health to be included along with an increased focus on health equity within the program objectives. Differences in health can be striking in communities with different social conditions. For example, this study by Erica Chang and David Kindig found an association between income and mortality among U.S. counties. Life expectancy varies by location, and in the U.S. has been found to be lower in the Southeast. And life expectancy has been found to be lower for men and women with less education. These unfair and avoidable differences in the health of specific population groups, known as health inequities or health disparities, are largely due to the differences in social, political, and economic conditions. To achieve health equity, these social determinants of health must be addressed so that everyone can achieve their full health potential. The concept of health equity is different from health equality. Equality means giving everyone the same thing, while equity means giving people what they need to reach their best health. Recognizing that the Institute for Healthcare Improvement's triple aim has not moved us to better health equity, the Association of State and Territorial Health Officials proposed the triple aim of health equity, a multi-pronged approach to improve health equity by 1, expanding our understanding of what creates health, 2, strengthening the capacity of communities to create their own health future, and 3, implementing a health in all policies approach with health equity as the goal. Expanding the understanding of what creates health includes having a sharper focus on the social determinants, similar to the Public Health 3.0 concept. Data about the social determinants of health can be incorporated into community planning and policy development. Click on the links to explore some of these data and mapping tools.
We use some of those tools when we put together our community health assessment every 3 years.
Strengthening the capacity of communities to create their own healthy future involves a collaborative, community-led approach that results in a more resilient community. One strategy for building community capacity is using a place-based approach, which means empowering a community to take action for its own health. A health in all policies approach, with health equity as the goal, recognizes the concept that health is created by multiple factors beyond the healthcare and public health sectors, and that policymaking in other sectors, such as transportation or housing, needs to take health into account. One way to use a health in all policies approach is to apply a health equity lens to issues and policies that shape the determinants of health. This can be as simple as asking core questions about a policy or practice that is being considered, such as, who is affected? Have those affected helped to shape the program or policy? Who is included and excluded? Who benefits and who is harmed? What do the data tell us and what data are missing? Who is not at the decision-making table? What values underlie the decision-making process? And what could be done differently? This document demonstrates how the essential public health services can include addressing social determinants of health inequities. See if you can match the essential services to the examples provided.
Would you like to do the activity or just do the summary? Probably the summary.
Public health is what we do as a society to assure the conditions in which people can be healthy. To do this, we must understand all the factors that determine our health. Clinical care, genes and biology, and the physical environment all contribute to our health. And health behaviors and the social, political, and economic factors have an even bigger impact. Addressing the social determinants of health will be important to reaching health equity where everyone can achieve their best health.
There you go. Any discussion or questions?
That reminds me of a article that I read several months ago, actually. But there's some like emerging research about how like light exposure at sort of like the darkest points of night is correlated with decreased life expectancy. Like, you know, so many things like in our environment and our day-to-day lives that that we don't necessarily think about as a health risk actually affect sort of health outcomes and longevity. So that sort of reminded me of that, and it was a good reminder to see sort of the comprehensive you know, tapestry of things that affect us and affect the community that we're here to serve.
And another good example of why it's important to continue to do research, because there are things that are in our environment and today that weren't in our environment 100 years ago. And so that ongoing research does drive evidence-based public health practice. And so understanding how technology is impacting our teens right now is something that we didn't have to think about 50 years ago. So, yeah.
I was also thinking about, I think this sort of, as we were listening to that, it sort of reminded me, or I was processing our discussion about kind of funding and the sort of array of factors that affect health outcomes and public health outcomes. And I do wonder if, given our sort of anxiety around the budget, around sort of access to federal funding, is there any is there any like effort going on at the sort of federal level that we could get involved with as a board, or even know about, similar to kind of our involvement with the legislative session here at the state level, that would help, that we could use sort of our position on the board to reach out to our federal representatives and making sure that we do everything we can to ensure that we have funding that we've relied on.
Yeah, absolutely. I think there's several things that the board can consider. I think reaching out to our congressional, our congressmen that represent us in DC, similar to what you did during the legislative session, passing a resolution in support or having a comment or a statement about that absolutely can be done. You're all connected to the National Association of Local Boards of Health. Many of you probably get regular emails from them because we put once you become a board member, we put your email in to the NALBO system, and they send out calls for action for boards of health to think about. And then there's an American or Association of Public Health, APHA, American Public Health Association. So our National Public Health Association, they are heavily engaged in advocacy and lobbying efforts. And so keeping in touch with what they are doing and supporting what they're doing is another option.
Great. Yep. I guess, does anybody have any opinions on potentially coming up with a resolution to send to, I guess it would be our local, well, our Montana congressional delegation that sort of outlines where we've seen, like where we rely on federal funding the most and sort of like where it comes from and how we rely on that.
Do you have any comment on that?
Well, I think that, we're in a position of executing policy. I don't think that we as a Board of Health are in the position of making policy.
But he's talking about influencing our congressman
and I think, maybe next meeting we could look at a draft resolution and consider, like, does anybody have strong feelings about just looking at a draft?
I think that's a great idea.
Okay.
I would be for that.
Okay.
Why wouldn't we? Because you never know. All you can do is try.
Great. So maybe let's add that to the next meeting agenda.
Yep. And I'm happy to, what I'll end up doing in preparation is reaching out to our national associations and having them help pull some language together, and we'll have something for you to look at in the packet in advance of the next meeting so that you have time to think about it and review it. Yes, ma'am.
I don't think I'm getting those emails from Nalbo.
Okay.
We have a rather sensitive spam filter, but I've not seen anything there, so.
Okay.
It would be great just to make sure, because I would be interested in seeing this.
I will check on yours. And yourself and Dr. Nast, as being new, that might not take place until next month. For that cycle. But I'll check your email.
Real quick to add in addition to thinking about doing a resolution or some sort of other advocacy. I have also heard it is effective, and even national level representative offices are fairly open to doing like phone calls, other types of meetings, and that does get more attention than an email or a letter.
Yeah, and Dr. Ness, thank you for that prompt, because I met with Senator Daines's staffer here in the Helena area. She reached out curious about our measles response and preparedness activities. And I took that as an opportunity to expand the conversation to things other than just measles. So I did encourage her to communicate back to Senator Daines how important that federal funding is to local public health, and gave her a couple of really important examples, like our suicide prevention work, for example, of how that is entirely federally funded. So yeah, thank you for the reminder that there are congressional district staffers that are embedded right in our communities are always open to conversations. And if you'd like to have an invitation to one of them for a Board of Health meeting, I'm happy to do that too.
She's just on maternity leave. It might be a good opportunity to have somebody from the Healthy Mothers Group touch base with her.
When she was in the building, she had lots of questions about vaccinations of her newborn child. And she also made sure to take information about the Universal Home Visiting Program. So we made it worth her stop when she popped into the office. So,
One thing about the written document that will help too is it will give us talking points, right?
Mhm.
Because I think a personal call is much more effective than like a letter.
But you can do both.
Yeah.
And you can do both.
And then
Correct.
Tom, though, it's like what committees they're on, who would be the most effective
Well, I think
legislator?
I think Senator Daines is probably in the strongest position because of his seniority,
Mhm.
and he's on some of the committees that relate to budgeting. So I think that I can't remember the one he's on. I just had a conversation with some folks at NAMI because I felt like there was an opportunity with this executive order that came out, to maybe mold some of the things we're doing here to get some extra funding for opening the journey home and supporting that long term. And I might, if I have any luck getting that, I'll pass it along.
Yeah, thank you.
That'd be great.
Yeah.
I'll have something prepared for next month.
Great. Any other discussion on the training or anything that came up from that?
That was good. Thank you for that.
All right, moving on to announcements.
All right, so one of the announcements, it will be very brief. I just wanted to bring back to your attention that the 2025 Community Health Improvement Plan is posted and finalized. When we unveiled the 2025 Community Health Improvement Plan, we also wrapped up the previous plan. And there's on our website, there is a recorded presentation of all the work that happened to help move those goals and objectives forward the previous 3 years. So those plans are a 3-year plan. And Shannon was able to attend the presentation. It was recorded and it is posted. And so, and then for the 2025 Community Health Improvement Plan, we have coalitions that have committed to moving the next 3 years of work forward. And so if you're interested at all in efforts around chronic disease, behavioral health, or housing, I'm happy to connect you to one of those coalitions if you're interested. You'll be receiving ongoing updates, and we'll do an annual report out to the community as we've done in the past. So you'll get opportunity to hear about the work that's happening. But if you'd like to engage actively in any of that, please let me know.
And then board communication needs. So Drenda and I have been working, mostly Drenda has been working on trying to think about ways to better streamline or kind of standardize board communications. And so this was something that came up in our sort of evaluation, annual evaluation of the health officer. And maybe this is just a me issue. I think our board updates usually come through email, but they, aside from the agenda, don't come at a kind of regular schedule. And, we just sort of get updates as they come in. And I found it's easy to sort of lose things or keep track of events that really we should have board presence at. So we've been talking about ways in which we could improve the communication amongst the board and with the board. And I wanted to just kind of touch base with everybody and see if Drenda's explored a few sort of options for communication platforms, but I wanted to touch base and see if anybody has strong opinions about communication platforms, either for or against certain things. If you really like email, if you really like the Microsoft suite of communication using Teams or any other type of, communication platform that you've used that might be useful sort of for the board to have really kind of dedicated communication channels outside of our meetings. So I wanted to bring that up. We might not, we might not need to make any changes. Maybe it's just a me issue, but I wanted to the opportunity.
One thought, when you send out new emails about what's going on, I mean, something like this where it's got everything listed.
Yep.
And then something new
Mhm.
highlighted, that's that the actual email is about, it'd be simple. So every time you send out an email, you have this, and everything that's past is off, but everything that's relevant is on, and then the new thing is highlighted.
Okay.
I think that would be a simple
Yeah.
way. You could just print it out, have it on your refrigerator like I do.
Mhm.
Otherwise I forget.
Okay.
Please no Teams.
No Teams.
Please.
Great.
Teams.
Okay.
I have too many Microsoft accounts for too many jobs and it gets super confusing and I'm always signed into the wrong thing and please, anything but Teams. I beseech you.
Great. SharePoint?
So
Yeah,
that's another.
that's another
When
one.
we have multiple jobs,
Right.
part-time for the city, I have, another job and those
Okay.
things where you're signed in for one account get very complicated when you're working off one or 8 laptops.
Yeah.
Yeah. That's good feedback.
Yeah. And we had talked about, even if it's just sort of more regular, like kind of making a regular schedule for email updates, either weekly or bi-weekly, whatever the need is.
Like every Monday, every Friday, every wherever.
Something like that.
Like
Yeah.
a newsletter style, formatted similar to what you just
Yeah,
suggested.
I think
where-
I like this.
I like email myself.
Yeah, I do too.
Do you have a preference?
I don't have a preference.
I agree with you on Teams, 100%.
No, okay,
Okay.
great. Any other feedback on that? All right.
Is the board opposed to another platform at all? We're using Monday.com internally for some things, and Sandy was playing around to see if that could potentially be a tool that the board could adopt, but it would be another app on a phone or another another system to log into.
Yeah.
So if that is a burden, then yeah.
Just to give you an idea of like what that could look like is, it would be a place where you could go and there would be sections. So it would say events. There'd be a calendar there. So you could see what community events are around. The board could look and see that for the next quarter, there's, reading for life and bicycling for buddies and see the different events. And you would have the option to say, oh, I'll attend that one, which would allow the rest of the board members to see that, oh, okay, Lisa's going to be at that event. Nobody's noted that they can attend biking for buddies. I'll do that one. So there would be an option to be able to track community events, facilitating the opportunity to have a Board of Health member at as many community events as you're interested in. There's a discussion board that is an open board. So if Mike, you've started a discussion about talking points for the resolution and who you might call, Sherry might pop on there later and see that, oh, there's an update. And so she would be able to follow along in the conversation that maybe you started that you picked up in. So there's some options there. The draft that I created also had a board education area. So I have variances. So you could click on that. There's files associated that would run you through if you find out that we're going to have a variance scheduled in next month's meeting and you were new to the board and you're like, what is a variance? What does that hearing look like? What are the procedures for that? So there would be the opportunity to have more education items for the board to use as reference. So it's kind of a multi.
Is it an app? Is that what you said?
It's a platform. Monday.com is a platform. You could have it, on your computer, your phone, whatever you want.
So it's kind of like an app.
Yeah.
And you would get an email notification that there's something happening and then click to get into it.
Yeah.
And you don't have to have a county email. all emails are accessible, which is some barrier that we ran into in some of the other platforms. And so it is something that Sandy's been playing around with. So, but it would, the email would help because it does prompt you in your email that there's something happening in the platform and you just click and it takes you there rather than having to remember to log in.
I can't stand the login things, so I check Facebook, Messenger, messages, and my Outlook.
Yeah.
Those are the only
Yep.
things that I access.
Yeah.
So it would work.
Yeah.
Yeah.
If it gets too complicated, I won't do it.
Yeah.
Because
Yeah.
Can we see a demo of it at the next
At
meeting?
next
That
meeting?
might- Theoretically, that sounds interesting, but if we could just see what it looks like, I'm worried, if there's an email that reminds me, that helps.
Mhm.
Yeah.
But
yeah,
otherwise,
email,
forget
I like
about
that.
That was my experience when we were playing with it. She did something and I got an email prompt and I then clicked on it and it took me right in and I could see what it was that she posted in there.
That I like.
Yeah.
Could
Okay.
you send me a link? I'd like to play around with it.
Yeah.
It's awesome.
Just don't make
Mike
it
can be a demo
too
for you.
complicated.
Yeah.
People
And
won't look at it
Right.
like me.
Exactly. Yeah.
And it's such a flexible, Monday.com is so flexible that as, you know, we could build out a few things and then as you gain comfort with it or have ideas, we can expand, contract, change. It's not rigid. It's very flexible and
Yeah,
Sandy's getting really good at building things in there.
Skills or the opportunity, you can use it for everything, from planting your garden to, building an electric bike. I mean, there's just so many ideas that you could do in there, but you can also keep it. When I built the board as a draft was just very simple. A place where you could track community events, a place where you could find some education, or past resolutions, an easy place for you to find some files. You're right there, so you're able to do everything in one, and be a part of a discussion. You know, you're there, you're looking at, I just use variance as an example, but you're reading the literature on variance procedures, and you're right there. You can start a discussion going, Lisa, are you still the hearings officer? Do I have to do anything? So all right there without having to read something over here, then go to an email and then find someone's name and, so.
Yeah. So
As long as there's
demo.
some transfer back and forth and we get a prompt from our regular email.
Yes.
Yeah.
There, that
Yeah.
would be-
Yeah,
that'd be
anytime
great.
there's activity in the board, you can set your notifications to what you want. But anytime there's activity in the board, you'll get a note. And then of course, we can, Brenda drafts this resolution. She could have it in Monday.com and she can send an email that specifically says the items and you can all go there and collaboratively work on
Edit
it.
and it's a nice collaboration tool and just has ability to just have discussions and so,
I like
but
that.
I think we can prepare a demo for next
Yeah,
meeting.
I will, I'll continue on this. We're like I said, learning lots of different ways we can use it. So, it's a trial, try this. Does that work? No. Okay, let's try this.
Yeah.
So.
Yeah, so thank you for suggesting that we look at Monday.com as an option.
Yeah.
It's, we're paying for it for some other reasons internally, and it would be no extra cost to do something like this for the board. So,
Nice.
Great.
yeah.
Which is wonderful.
Yeah.
Yeah.
That was some of the other options were quite expensive. So so that's good. Thank you.
Dr.
And
Ness,
then-
have any-
Dr. Nass, did you have any input on that?
No, I think what was said has answered it. I think it will be helpful, at least coming on as a new member, to be able to understand better the use cases we're looking for too. So I think a demo would be really great.
Great. Excellent. Thank you. All right. We'll move on to a public comment on any matters within the board's authority that have not already been addressed.
Senator Dunwell had her hand up earlier, so this probably is connected to the earlier discussion about funding and advocacy, but
Yeah, Senator Dunwell.
Thank you very much. Mr. Chair, members of the board, Officer Brenda Neiman, hello. It's Mary Ann Dunwell again, State Senator for the Lewis and Clark area. appreciate if you would write a letter and or meet with members of our congressional delegation. We in the state legislature, like you, are grappling with the programs that we can continue to fund and those that we can't. So I appreciate you taking a look at the programs, given that your role is not to implement policy, it's to execute it. And so I agree with Commissioner Rolfe in that comment that he made. And I think your advocacy could be that please reevaluate some of the budgetary issues with the programs funded. For example, the cancer prevention that you were talking about, because it will help us implement your policies along those lines. And as far as meeting with the congressional delegation, I found that Troy Downing's folks as well are very helpful. I recently met with them about a couple of different issues, and they were extremely responsive. And he's got folks here in Helena. And then the other thing, I'm trying to read my rating, I'm sorry. Can't read it. I have had recent surgery in my dominant hand that I write with, so it's really hard for me to understand my rating. So again, thanks for what you do, and I'll stop jibber jabbering right now. Thank you.
Thank you. Any additional public comment? All right. Thank you, everyone. We are adjourned.
Thank you.
Just one very, very quick thing to add.
Oh, yes,
Sorry
ma'am.
to be jumping in at the end. As we know what programs may be at risk, thinking about one, where we might want to advocate, it would be helpful if those programs that we want to advocate for are putting together stories of individuals who have been impacted by the program. Those are yes, we want to see numbers, but from an advocacy standpoint, individual stories have been proven pretty well to be more effective.
Yeah, and case in point, the story that Mary told when she gave her update on the universally offered home visiting program. Those are the stories that are going to touch people's hearts.
Yeah,
and
you'll remember it.
Yeah. Thank you for the reminder.
Just one thought. I think it's really important to remember that if we advocate, we're advocating as individuals, not
As the Board of Health.
not as a board.
No, you can as a Board of Health, as long as you all agree and vote on it.
Yeah.
Yeah,
But
so a letter
the
of,
problem that we ran into was Montana Association of Counties has warned us not to have advocacy in general advocacy from people who work for or are on boards, because that puts us in a different position for total cost of advocacy that has to be reported.
sure. And so there's a difference between advocacy and lobbying, and we'll make sure to talk about that next month. Yeah.
Right, that's right.
Yeah. Yes, we'll be careful not to lobby,
Yeah,
but we will advocate until our faces turn.
that's right. But advocacy as an individual is very much wanted.
Yeah, and as an advocacy as a board is okay. It's just the lobbying we need to be cautious of.
Yeah, yeah.
Yeah. Okay, thank you. Thank you, Dr. Dan.
Thank you.
Thank you.